So it looks like we've got people from all over the state. I hope everyone is recovering from a night of voting confusion and mixed messages and good messages and not so good messages. But welcome to our Healthcare for All program tonight. Thank you for joining us as we address health equity tonight, part of the path to universal health care. If you came to join Fran Rourke to help us become allies in navigating transgender diversity, then you're in the right place. I'm Ronnie Shure. I'm a retired pharmacist. I volunteer as your president, although it feels like a full-time job. But you too can volunteer with Healthcare for All. We won't ask you to make a full-time job out of it. We will be posting a link in the chat. It'll be a donate button, but when you go to our website, you can navigate to a volunteering button. You can navigate to a button that says get involved, and you can fill out a form asking or telling us where you would like to participate. While you're on that website, make a donation if you're able. Every donation helps us move a step closer to universal health care. We are set a goal of raising $300 during this program tonight, and you can find that link for making that donation in the chat. After Fran's presentation, the leader of our fundraising committee, Peter Lucas, will talk with you about different ways to donate. And while you're in the chat, you can put your questions or comments. Cello Echeverria will be monitoring that chat and will ask the questions right after Fran finishes their presentation. Then we will start the questions. So one other thing, which is you can click on the closed caption icon at the bottom of your Zoom screen. There's a button that says what? It says live transcript. If you push the arrow next to that, then you can open up the closed captions on your computer. Let's start with participating in this Zoom meeting today from the lands of the Coast Salish people. Please take a minute to acknowledge the peoples in the lands where you are joining us from today. I see people from all over the state. So take a minute to acknowledge the people in your land. We acknowledge all of the ancestral homelands and traditional territories of indigenous peoples who have been here since time immemorial. Our efforts to achieve healthcare for all includes universal healthcare coverage for Coast Salish people of this land, the land which touches the shared waters of all tribes and bands within the Duwamish, Muckleshoot, Puyallup, Suquamish, and Tulalip nations. So I've muted everyone, but please feel free to participate by going into the chat, adding your comments and questions there. Tonight's speaker is Fran Rourke. They've had a long career as a registered nurse, including many years where we worked together, Fran and I, at Harborview Medical Center. After retiring from their nursing career, they studied gender therapy while working on a master's degree in English studies. And now they've moved on to work as an emergency medical technician with the intention of focusing on health equity and providing that emergency care. They are a member of the Diversity Alliance of the Puget Sound, which is an organization by and for gender diverse people. And to paraphrase Ben Vereen from one of my favorite films, All That Jazz, let me introduce you to a great critical care nurse, a great emergency medical technician, a friend of mine for over 30 years, and an ally in the movement to achieve universal health care. Fran Rourke.
All right. Great to be here. I have a little presentation I'm going to do for you. So let's get started. I'm Fran Rourke. I identify as a transgender non-binary person. I use they, them pronouns. And I'm here to talk to you about the transgender community and the healthcare needs of our community. So here's the objectives: to increase knowledge of transgender, talk about healthcare needs, support the concept of healthcare for all, and talk about standards of care for transgender people. So we're going to start with a little bit of gender theory. It's not gender therapy, Ronnie, it's gender theory that I studied, just because I don't really want to be a gender therapist, or I am not, don't want to claim that. So there's 4 concepts that you really ought to know. Most of you probably do, so I'm going to go through this rather quickly. People conflate these a lot, but they are 4 separate things. Sex assigned at birth is not the same as gender identity, and it's not the same as sexual orientation, and none of those are the same as gender expression or presentation. Okay, sex assigned at birth. So when you're born, the doctor looks between your legs and slaps an M or an F on your birth certificate. But we've come to realize scientifically and otherwise that that's not all there is. And Consuelo, if you have that link for the video, I found this video on YouTube this morning that looks pretty interesting. It's entitled "Science Proves There Are More Than 2 Human Sexes." And it talks about the different ways of determining sex, intersex people, which are, I guess they're now calling them sexually diverse people. So gender identity. That's basically.
So Fran, I'm sorry, I'm just going to interrupt.
Go ahead.
When it comes time to share the movie, I'm going to stop sharing your screen.
Oh, okay. I wasn't intending to actually play that video. I was just giving the link, but
Oh, okay.
It's about 18 minutes. So if we want to show it, you should factor that time in. But my presentation itself is also about 18 minutes.
And so our intention is for people to save that link on your desktop or iPhone or iPad and then watch it later. So just save that link.
That was my original intent.
Okay, sorry for the confusion. I just put it in the chat. Sorry about that, guys.
Thanks, Consuelo. Appreciate it. So, gender identity. In your heart of hearts, what are you? What do you know your gender to be? Are you a boy? Are you a girl? Are you somewhere in between? Do you fluctuate? Personally, I feel like I fluctuate. My gender identity changes on a daily basis or frequently. I'm not really a boy. I really have never felt comfortable with that. I'm not all the way girl either. I'm kind of in between. I'm on the spectrum somewhere between male and female. And if I'm being honest, I'm probably a little closer to female than male. So I use they, them pronouns. But I also accept she, her, especially if I'm having a particularly femme day. Sexual orientation, that's actually, I'm not sure if people can manipulate the picture panel so that it's not covering the print of the slide. I'm not sure how that works. Well, this is what we see. Oh, okay, that's great. Yeah, Toby just showed me. It's awesome. So sexual orientation is also very diverse and complicated. And here's a fun fact. A lot of transgender people, as they go through transition, their sexual orientation can change. A lot of people, I've heard a lot of people say, you know, I've been attracted to women my whole life, but you know, now guys are kind of I'm starting to feel attracted to guys too. So that's a thing. Gender expression and presentation. That's how you present yourself to people and how they read your gender. So if you go to the grocery store, do people call you sir or do they call you ma'am? I have gotten both, depends on what I'm wearing. If I'm wearing a mask, I tend to get more ma'am. I paint my fingernails, I wear earrings, I dye my hair, it's in a ponytail. I get both. And I like it that way. So transgender and transition are, here's definitions for them. Reason I put that there is because cisgender people often tend to conflate sex and gender because for them, they are the same thing. But if your sex assigned at birth does not match your intrinsic gender, then you are transgender. You meet that definition. And transition is the process of accepting yourself and or changing as you need to. Now that you're up to speed on gender theory, basic gender theory, let's consider the healthcare needs of us trans folks. So wouldn't it be handy if there were an organization that would come out with some standards of care? Well, most of you, I suspect, might know that there is such an organization. It's called WPATH, the World Professional Association for Transgender Health. And there is a link to it. They put out standards of care, and they've been at this for a while. Their current standards of care is version number 8. So there's what the cover of it looks like. I'm going to go to the next slide, which is the table of contents of WPATH SOC 8. You'll notice there's a number of topics covered there. My eye was drawn to chapter 9, eunuchs. You're never going to hear a transgender person use that word. It just doesn't fit because eunuch is a male person who has had their gonads removed. And there are transgender people, a lot of them who do have orchiectomies, but they are transgender women. They would never identify as males, so they would never say that they were a male with gonads removed. I don't know how that term got past the censors, but you'd never hear a transgender person use that. You just wouldn't. So I bring your attention then to chapters 12 through 18. Those are the topics that I'm going to cover tonight, and those are kind of an overview of what the needs of transgender folks are for healthcare. There are some barriers that are specific to the population. Transgender people tend to experience high levels of unemployment, which goes along with poverty and lack of insurance coverage, forcing them onto Medicaid with the limitations that entails. Mental health is also a hindrance. There's a very, very high incidence of mental health issues in the transgender community. There may be lack of specific coverage for some of what we need, and some of the providers are not very well educated. Talk about that more later. Hormone therapy or hormone replacement therapy. There's actually two categories. There's puberty blockers, which are given to transgender people that are still children. There are people as young as 3 or 4 years old that will assert a gender different than the one they were assigned at birth. And in order to avoid puberty effects that would cause them a lot of dysphoria, they are given puberty blockers. And this can be done usually in the early teens, right at the beginning of puberty. Hormone replacement itself There's a kitten on my leg. Um, hormone replacement therapy itself, consisting of testosterone or estrogen and progesterone for trans women. Non-binary people on an individual basis may take hormones as well. I actually do not. I do take a testosterone blocker though. Hormones are often started around the age of 16. And if you're a primary care provider for trans people, you really need to educate yourself pretty well on this stuff, because they're going to come into your office and know a lot about the different preparations that are available, whether they prefer pills or patches. If you're going to take care of trans folks, you need to know a lot about that. Surgery and postoperative care. Surgery is a really complex process. First of all, you've got to arrange coverage, Medicare, if nothing else. You've got to find a provider, and the providers are few and far between, and they are booked months out. Most of the people I know that are having surgery, they're 6 or 8 or months or a year out from the date that they're going to have their surgery. Coordinating the schedule is an issue, and meeting pre-op goals is something that must be done. For example, if you are a male to female person having bottom surgery, which is a vaginoplasty, GRS, let me go through some of these abbreviations here. GRS is gender reassignment surgery. FFS is facial feminization surgery. Top surgery, male to female. Top surgery, female to male. Top surgery for male to female would be breast implants. Top surgery, female to male, would be breast reductions. GCS or GRS is gender reassignment. GCS is gender confirmation surgery. Hysterectomies, orchiectomies, tracheal shave, which would be reducing the Adam's apple. VFS is a vocal feminization surgery, which is not the results are unreliable on that. That's a surgery that attempts to shorten the vocal cords to make the voice higher pitch. And this is not a comprehensive list. There are many different procedures that people can have done. I've even heard of shortening clavicles to make the shoulders not as broad. I mean, all kinds of things. You name it, there are people that probably have done it. Let's see if there's anything else I wanted to say on that. Nope, that's it. Let's go on to the next one. Voice and communication. Testosterone largely accomplishes voice change for trans men who are taking vitamin T, as they call it. They go through the same kind of process that teenage boys do. You know, voice cracks. It goes from high to low, and you know, all that kind of stuff. So it can be very kind of embarrassing. And the amount of change that people get varies from person to person. In the other direction, trans feminine people who have gone through male puberty, their vocal cords are thicker and longer, and so their voices are deeper, and that cannot be reversed reliably. The VFS, it has mixed results. So they are limited to voice coaching or this tracheal shave, which I said is unreliable. Voice coaching can do quite a bit. There are some really good voice coaches out. Of course, they're expensive, often not covered. But there, if you look on the internet, go to YouTube and search for trans femme voice coach, you'll find quite a bit of people that do videos there that people can take advantage of. And I'm just admitting, no, not admitting. Going to talk a little bit about communication changes related to expression. gain or loss of male privilege. I noticed myself, depending on how I'm presenting, if I'm, say wearing a skirt, looking more femme than masculine, I get treated differently. I don't have as much space. Men take up more space. It's really an interesting phenomenon to like go on public transportation, presenting in different ways and see how people react to you. I have fun with that. So to be a primary care person, you got to be a really good listener, be humble, listen to your patients, give them what they want, unless there's a really good reason otherwise. It's tough to find PCPs with all these attributes. People are constantly searching and sharing recommendations. Diversity Alliance has a Discord, which is a server that people chat on, and there are many different topics spoken about, written about there, including healthcare providers. Reproductive health. See, where am I in my notes here? Some trans people do want children. There have been cases where a trans man will get pregnant by his trans wife. People can save egg or sperm before they have their surgeries that would get rid of the ability to do that. I know of a trans woman who is a doctor who banked sperm before their gender surgery and used it later on to become a father or a mother, depending on how you look at it. Another thing to consider is that trans masculine people have beards and low voices and look man-ish, look masculine. I guess that's a better word. But they still need pap smears because they still have a uterus. So they have to go into a gynecologist's office. Imagine how awkward that is. STDs are just as likely in the trans population. In fact, for some folks, especially trans women of color, sex work is the only option they have to survive. And so they're at, of course, much more risk. Nah, they're fine. There's kittens playing at the wires underneath me. I'll ignore them. So, sexual health, sex education for queer folk is almost non-existent. People just don't know how to teach it. Most people don't know anything about it. So it's, kind of you and your partner teach each other, I guess, for most folks. But care providers should make every effort to maintain and enhance sexual functionality as they bring about transitions. Sometimes possible, sometimes not. Mental health is, I think, one of the most important aspects of trans healthcare. One of the things that has been an eye-opener for me working with trans people and among trans people is the pervasiveness of mental health issues. Severe depression with suicidal ideation is extremely common. I have had depression with suicidal ideation. I have not attempted, but a great many people do. According to the 2015 U.S. Trans Survey, 40.4% of trans people attempt suicide at some point in their lives, far above the general population. And there's a wide variety of things that happen. There's a lot of trauma. A lot of transgender young people are kicked out of their homes when they come out to their families. There's a lot of PTSD, attention deficit, ADHD, autism spectrum, OCD, bipolar, I even have met some people with dissociative identity disorder in the trans community. I'm just been astounded by how common and pervasive and wide-ranging the mental health challenges of the community are. Good therapy and peer support groups are essential. Diversity Alliance does have some peer support groups. Special considerations, need to keep the barriers to care low. A lot of trans people with mental health issues don't have much energy to be able to cope with having to go through a lot of bureaucratic barriers. A lot of trans people change names. I have not changed my name. Fran is my actual middle name. I don't use my first name anymore, but I did not legally change it. Most trans people do change their names. So don't make that a barrier. And respect the name and the pronouns as we give them to you. If you don't do that, you're telling us you don't respect us, you don't see us, don't consider us valid. If you're a primary care provider and you do that to your patient, good luck forming a bond. Here's some links. Let me end with a story. There's a transgender person that I know, someone that I work with in a volunteer situation. This is a transgender man. So assigned female at birth, has endometriosis, which makes periods really agonizing, and has severe depression, sometimes just cannot even make it through a volunteer shift. So we were working one day, volunteering at an agency where we both volunteer, and we were doing food prep. So we were dishing out food for our participants, and he couldn't even just cope, and just went into the back pantry and curled up in a fetal position and was just sobbing for probably a quarter of an hour. It seemed like a long time. Finally came out, and I said, you know, I really feel bad for you. I wish there was something I could do. And he said, I just need health coverage and a good doctor. So there you go. There's some links, the Ally Guide, there's the Diversity Alliance website. Gender Unicorn is a fun thing. If you can go there and play around with finding out your different aspects of your identity on various axes and spectra. Here's the works cited for those of you who like MLA format. Thanks for the opportunity to speak to you.
Well, thank you, Fran.
That's the end of my presentation.
These are important issues for us to stop and take a look at. So we appreciate you taking the time to organize those thoughts for us. If you have questions, please put them in the chat. Consuelo will organize those questions for us in a few minutes, and we'll bring Fran back to the screen. But right now, let's take a minute. I'd like to introduce another member of Healthcare for All, Peter Lucas, who leads our fundraising events or fundraising approach. So, Peter, do you want to take a few minutes to tell people how they can donate?
Absolutely. And Fran, I want to thank you for that really great presentation. Learned a lot, and I appreciate it. And so, yeah, as we do all the time with these presentations, we use this as an opportunity to toot our horn and tell you about what we've been up to. We've had a lot of legislative successes in the last few years, and we were one of our biggest ones in the last couple of years was the universal healthcare commission, which is going to hopefully develop a system to provide universal health care in Washington state. And in order to maintain our momentum, it is vitally important that we grow our membership, educate the public, and mobilize our supporters to spread the word to their family, friends, and most importantly, their legislators. And we do this work through such things as social media, these monthly webinars, such as tonight's excellent presentation, meetings with civic groups, and by hosting other events. And we're just starting to get out from behind our laptops and doing some in-person events, and we hope we can continue to do that as long as the pandemics don't get too bad. And we have a new lobbyist, very dynamic person. We have a communications specialist, and we have other fixed costs. And as you might imagine, these activities and obligations all require funds, which is why we are asking you to donate tonight. And as Ronnie mentioned earlier, our goal is $300. So you can go to the links in the chat or on our website and click on the donate button. You can make a one-time donation, but we would especially appreciate if you can make a monthly recurring donation to provide consistent support. And tonight, a first, very special, if you make a donation, you will receive an authentic Healthcare for All Washington scarf modeled here, just in time for the onslaught of the wet and cold winter. So yeah, you can see Ronnie showing you the scarf. So please make a donation. As I say, click on the links. And thank you so much for participating.
And so we will mail out a scarf to anyone who makes a donation tonight. So please make sure that you put your name on our website or address on our website when you make that donation, or add it to the chat, and we will track it down and get those out in the mail to you. So thank you all for any donations that you are able to make. So thank you, thank you, thank you. So let's go back to Cello and Fran and pull up any questions that are in the chat.
The first question that we have, and I'm not sure who this is from, this person asks, why do so many people feel that their bodies do not fit themselves? Just like ADD, I think we are biologically causing more gender conversions. We have known for years that polluted streams with too many biotoxins render too few males and fish and frogs. Our chemically infested diet and lack of natural nutrition might be aiding in the body's new biological processes. Indigenous people have recognized two-spirit people for eons. It seems to me that the growth and population of two-spirit is most likely biological at this point. And Fran, they're asking for your thoughts on this, please.
Well, I have no way to know whether it's biological or not. Although that video that I sent the link to talks about some of that. My take on that, my guess, is that it's kind of like left-handedness used to be. My grandfather told me that when he was in grade school, anybody who wrote with their left hand got hit with the ruler, and they made them change to the right hand. And so if you plot a graph of the number of people who identified as left-handed, it was pretty low in the early 1900s. And then as teachers stopped punishing left-handed people and they were allowed to write with their left hand, the number of left-handed people identifying went way up. It's still less than the right-handies, but I think it might be a similar phenomenon where people did not even have the language to talk about gender identity. I mean, it took me a long time to come out. I just came out a few years ago because I didn't have the language to explain what was going on. And then when I went to grad school and studied gender theory, I had the language and I went, oh, you can be neither boy nor girl. That's me. That's what I am. And it took me, I had to have the knowledge before I could actually say, what my situation was. So that's what I think is happening. Could there be, with all of the pollution that's happening in the world, could that have an effect? Who knows? Someone should do research. I have no idea. Any other questions?
So, sorry, here I am talking away with me muted. Sorry about that, Fran. I have a question for you because I do not know very much about this at all. Thank you very much. What's the difference between gender reassignment surgery as opposed to gender confirmation surgery?
It's the same as the difference between 6 and half a dozen. It's the same thing.
Okay. So, but for insurance reasons, would they be coded differently or something? Is that why they're two different?
I don't think so. It's just
Okay.
the terminology evolves. The way people present themselves can be called gender presentation or gender expression. They mean the same thing.
Okay. Thank you. Toby asks if you could please talk more about insurance. What's covered, what's not covered, and barriers.
I think there are laws now that trans medication and procedures have to be covered. I think even Medicare and Medicaid are required to cover them, but what I'm hearing from the community is that people are being denied and then have to go and assert their right to have it. There are people within our community that are pretty good at knowing the quirks of that system, so we kind of mutually support each other.
And I can share that in the 2022 session, so earlier this year, the state of Washington did pass a bill, 5313, that guaranteed Gender Affirming Treatment Act that guaranteed that kind of care. So our Office of the Insurance Commissioner is a great place, or is the correct place to make those complaints since we have the law in place. Of course, there are other states that have almost opposite kind of rulings, and talking to friends and family in other places, it can get very frightening and very
places like Florida and Texas, they're killing a lot of people with their laws because gender affirming care is life or death. People that have severe depression with suicidal attempts, if they get the care they need, that goes way down. If they don't get the care they need, then a lot of them follow through on it. So it is a life or death thing.
These are hard issues to talk about and hard issues for legislators to address, but it's important that we realize this is a part of a universal healthcare system, looking at equity, health equity, and social justice. And I'm so glad you joined us tonight, Fran, to bring up this issue and to get us thinking about transgender issues and helping to clarify that in our minds. And you gave us some good messages about using the right wording. Words make a difference. So I'm glad you shared that with us. I really
got one more question.
Okay.
Don't turn them off yet. Marcia asks, how does a person whose gender identification fluctuates determine how they are going to present themselves on any given day?
Well, I can only speak from personal experience here. When I get up in the morning and choose what I'm going to wear, I asked myself, how am I feeling today? Am I feeling femme? Am I feeling not so femme? Do I want to wear a skirt? Do I have to go to work? If I have to go to work, there's no question. I'm going to be wearing a uniform. And it's kind of butch, to tell you the truth, but men and women EMTs wear exactly the same uniform. So it is both butch and what I want to say, androgynous. Lizzie's getting a kick out of that.
And
Any
I
other
think
questions?
And I think what you're saying, Fran, is that it really is an issue that comes from within, and we really need to honor that and pay attention to that in each of our lives. So thanks for sharing that. Thank each of you who participated tonight. We thank you, Fran, for really stepping out here and sharing your journey and the locations to find information. Thanks, Peter and Cello, for stepping in and helping make the on-screen actions enjoyable and smooth. And also thank you to the volunteers behind the scenes who you didn't see tonight: Ron Lovell, Rich Legoo, D.W. Clark. So thank you, thank you, thank you. And of course, thank each of you who joined us tonight. Please join us on Saturday afternoon, December 3rd. It will be our annual educational conference and meeting. There will be a similar presentation. Gary Goldbaum, who is a public health leader in Washington State, will moderate a panel discussion about public health in the age of healthcare uncertainty. So join us for that event on December 3rd. You can find that information on our website, probably starting tomorrow, as soon as we move on to the next step. That'll be a Saturday afternoon, early December. Then in January, we will return to our regular Wednesday nights, the second Wednesday night of the month. So thank you to people who donated. Thank you to people who participated. And thank you to everyone who showed up tonight. You really can help us make a difference. So with that, let's end the meeting and hope we'll see each other again on December 3rd. Thank you, thank you, thank you.